Listen, we have a lot to do. On, ready? Who's anchoring today? Ready? Let's go.
Let's get on to our next segment, which is
For Leilani Bonds, life moves pretty fast.
Trivia's next.
She wouldn't have it any other way.
I am a teacher. I've taught for the last 14 years.
Let's start the introductions.
I teach broadcast class, several classes of video production, and I also have a principal's class, which is a high school course. We mention kids.
Yay or nay.
I have 150 per semester, and they're pretty awesome, and my kids, like truly my kids. So I enjoy being with them.
But her fast-moving routine changed in an instant after receiving a phone call.
I was at school actually on my conference period. Unfortunately, the results were positive for cancer. It was invasive ductal carcinoma.
Just a week before, during her annual breast exam, scans showed a mass. A biopsy confirmed the diagnosis.
I was so overwhelmed with the initial thought of, oh my goodness, my family. Oh my goodness, my children. What are my next steps? And so it was terrifying. It was terrifying.
So good to see you.
You too.
Leilani sought the help of Dr. Radha Iyengar of Texas Health Breast Specialists.
Every cancer is different, and then the way that cancer acts in any one person is also different. So understanding the person and understanding the cancer and then providing the appropriate treatment always helps them do the best.
Additional testing confirmed Leilani had a rare and aggressive triple-negative cancer, which was caught early.
Typically with an early stage small breast cancer, surgery is the first step.
Because the tumor was smaller, I chose the lumpectomy because it wasn't as invasive as surgery.
At the time of the lumpectomy, we do sample lymph nodes to make sure there's no evidence of cancer in the lymph nodes. And fortunately for her, her lymph nodes returned negative, and all the margins around her cancer were clear.
After recovering from her lumpectomy surgery, Leilani began the next stage of her treatment, including radiation and chemotherapy.
Dr. Iyengar was the leader of the team. She referred me out to her team that she'd worked with. She was very instrumental in getting all of those appointments set up.
So if we take a look at the breast.
She was extremely informative, which kept me at peace, knowing things were going the way they should.
I always try to instill hope in my patients, no matter what type of treatment they're going to have to go through, that hope that they can get through it and survive.
2 years after her treatments, Leilani is cancer-free.
You have a new perspective on life for sure after cancer. I have been able to go back to my normal activities. I definitely recommend Dr. Iyengar and Texas Health Breast Specialists. She 100% was the reason why I got through that time of life the way I did, because she is so positive. I'm looking forward to grandchildren. I'm looking forward to traveling with my husband. I'm looking forward to more years in the classroom with my kids. I see life in a new light, and so take in the sunshine days, enjoy the rainy days. I'm thankful.